It's estimated that 1 in 5 young people face mental health issues every year, but many are unable to access support services to find help. This event aims to change that.
So today we're in York, which is one of the 6 places across Humber and North Yorkshire, and we've had a big event with young people and senior leaders talking about how we improve access to mental health support and services for young people.
The event gave young people an opportunity to share their experience of mental health.
It's really important because I think young people aren't involved enough in mental health conversations. I think their input is really important, especially for events like this, because it's where they actually get heard. And I want to try and use my experience to help others, really.
The services are just getting more and more filled up, and getting to speak with the people who are sort of running it and have opportunities to sort of change it is really important because it's just not spoken about enough.
But it comes at a time where lots of young people are facing difficulty trying to access support. 3/4 of parents have said that their child's mental health deteriorated while waiting for the Child and Adolescent Mental Health Services, or CAMS. NHS England, on behalf of CAMS, have declined to comment.
I mean, while I was waiting, I significantly deteriorated. I was referred from a GP and she said I was low risk. When actually we talked to a CAMS worker, it was the opposite. Because it's such a long waiting list, it almost feels like you're not getting attention because you're low risk, and it kind of brings you into this cycle of I'm not ill enough, so I need to make myself worse to get help.
People are just seen as not high risk enough, so they don't get support until they're at a place of danger, which isn't good enough, but that's what happened.
During the day, young people worked on recommendations to improve situations like this.
For those who do need a clinical service like CAMS, it's really important we get better at thinking about what do we do while they wait. We need to, as the recommendations today from young people showed, we need to be better at telling them how long they'll have to wait, but also what can we do in the meantime to support them while they wait for that specialist service.
And the organisers are hoping this event has a lasting impact in the area.
What we've tried to get today is we want the young people to feel they were listened to and taken seriously and recognised as experts in their own experience, which I think, we heard a lot of that from professionals today. We want the professionals from the whole range of services to take it back to their organisations, to the meetings they go to as part of their day-to-day work, and to really share that lived experience and the recommendations from young people and think about how they put it into practice in their organisation.
And the young people have some suggestions for government too.
That they need to put more resources into mental health because it seems to be lacking as the problem is massively increasing. So that needs to be addressed because people are struggling a lot more and just nothing seems to be happening about it.
I think it's give funding to the NHS and also give funding to the education around mental health. And there's a lot of misconceptions around mental health. It would make the life in the UK, and to be honest around the world, so much better if some of these things weren't left so long.